And if we still talk about the perspective, like I think it was 2007 when the kind of the sedentary behavior research started, and it's quite amazing that it's so late that nobody really did studies about excessive sitting before that. Why do you think we had kind of a blind spot that nobody looked at that?
Well, I guess I'd probably be honest and say I don't know for sure, but I do think that during this period that we've been researching physical activity and health and developing public health practice around physical activity and health, our societies have changed. And if you look at how we work now, how we use our leisure time now, we're sitting a lot more than our ancestors did. And so I think part of it is just our lived experience is such that it's pretty obvious that sitting is playing a much larger role in our lives than it did earlier. So I think that's probably part of it. But I also think part of it is research, and I think we are gradually learning more and more about sedentary behavior. I personally think at this point we know a lot more about physical activity and its impact on personal health and public health than we know about sedentary behavior and those outcomes. But and I think we need to hold ourselves to the same standard. I think my argument is not that sedentary behavior doesn't matter. I think it matters, and I think we've got growing evidence to to support that conclusion. What I think we need to know is ultimately, as much as we know about physical activity and health outcomes, and very importantly, I think we need to understand as much as we possibly can about the interactions between sedentary behavior and physical activity as they impact health outcomes. For example, I think a very important question is there a level of physical activity participation that essentially blots out any negative impact of sedentary behavior? So, for example, can you have an office job where you do a lot of sitting during the day, and then after work perform physical activity at some level that is sufficient to essentially overcome any negative impact of all that sitting you did all day? I think that's a very important practical question that we've got to try to resolve. In the last iteration of the U.S. Physical Activity Guidelines, we attempted to deal with this, by looking at interactions between, daily minutes of sitting versus, daily minutes of moderate to vigorous physical activity. And the concept is that, at some level of physical activity, you're probably immune to the negative effects of sitting, even at a very high level. But I think all of us that were working on that at the time would acknowledge that we need more research to refine that understanding of the relationship between the two.
And do you think there will be a amount in a way? And I would guess it could be for the kind of metabolic things and chronic diseases related to metabolic health. But if you think that the sitting posture is not probably ideal for our anatomy, so probably you would expect to see musculoskeletal problems even if you exercise a lot, or how do you see it?
Yeah, no, that's a very good point. And I do think that in studying the interactions between sedentary behavior and physical activity, we need to take an inclusive approach to looking at different outcomes. So chronic disease outcomes are important, but I think we need to take an inclusive approach and look at musculoskeletal issues as well, for sure.
Yeah, and if we go a little bit back to this public health, physical activity as a public health tool, how do you see the current state? What are the limitations? We have made a lot of progress, but where are we now, and what do we need to do?
Yeah, I try to be fair in my assessment of where we are, but I don't think we're making nearly the investment in physical activity in a public health application that we need to be. I think we need to celebrate our successes. I think it's wonderful that we have established physical activity and health units in public health agencies around the world. That includes the World Health Organization. I think it's wonderful that colleges and universities around the world have focused physical activity and public health specialization training programs. I think it's important that at the community level around the world, really, amazing things have happened. We have traditional investments like recreation and parks and school physical education and sport programs that have been there for a long time, and those matter. Those are very important ways for people to be physically active, and I think we need to acknowledge that those are there, and because they're publicly supported investments. In addition, we've had a huge growth in the private sector, in the health club industry around the world that it basically didn't exist 50 or 60 years ago. We had YMCA's and a few facilities of that sort, but now the health club industry is a mega industry around the world. So that those are all positive developments. And just one additional comment about communities. Sometimes when I feel like I'm getting frustrated because we're not spending as much at the state or provincial or national, federal levels as I wish we were on public health. I do think we need to look at the wonderful things that are going on in communities around the world to develop infrastructure for active transport. In the part of the world where you live, there's remarkable investments in active transport, and even here in the U.S., where I think we've been a little slow with this, at the community level, there are really some wonderful things happening. So that's the positive side. The side that concerns me is, if we're going to treat physical activity as the public health priority that the science indicates it deserves, we're a long ways from that. And you can sort of compare what we're spending in a country like the U.S. On physical activity in a public health setting, and compare that with what we spend on tobacco use abatement or in the U.S. we invest incredible sums in nutrition and that's wonderful. I'm not arguing that we shouldn't do those things, but if you look at the population attributable risk associated with those behaviors as compared with the same thing for physical activity, there's no balance there. With their proportionality. I just think the data would argue that we really ought to be investing a lot more on promotion of physical activity at the population level than we are. So for me, that's the background and the rationale. Now, the hard part of this is in order for us to convince policymakers that this should be a priority, I think our field needs to accept the fact that we need to learn more about how to do this well, because I think it's a legitimate concern for policymakers to want to know that their money will be well spent. That if the investment's there, then the benefit will be there, and we need to be honest with ourselves and accept that we need to learn more about how to do public health interventions that will be effective in increasing physical activity in populations at the community on up to the national level. In most countries, now point to my own in the U.S. as an example, we really have not done physical activity campaigns at anything like the level that would likely be beneficial. And there's some threshold. I mean, you can't do just a little bit and expect a big outcome. And I think, at least in the U.S., that's kind of what we've done. We've invested a little bit in public health interventions to promote physical activity. I guess hoping that we would get a big outcome, and we haven't gotten a big outcome. So you can't run a public service announcement at 3 a.m. in the morning and expect millions of people to change their behavior the next day. There's a proportionality to the investment that you make relative to the outcome you can expect. And I just think we've got to find the resources to well, first of all, learn how to do this effectively, and then try it in some places to demonstrate in a convincing way that if you invest X, you'll get X level of benefit. And we've got more work to do on that.
Mm. And so more investments needed. And you said, for example, about the health club industry, that's good, but that's basically for the active people, for the enthusiasts. But basically, very little is enough. How do you see, how could we activate the most inactive who don't really go in the gym, or at least not keep going? What would be the solution for the least active 10%?
Yeah, that's the huge challenge, and we certainly have a lot more to learn about it. I will say this though, there's one area where there's been great interest in the research is looking at the built environment as an influence on physical activity. And one thing that strikes me about the findings of that research is that you can go to communities or neighborhoods where all the resources are there that we think encourage, promote, enable physical activity, and find people who are absolutely sedentary. The flip side of it is you can go to some very deprived areas where you would say, there's very little support in this neighborhood for physical activity. It doesn't look like it's safe. There are no sidewalks. It's not an attractive area to be outside and be physically active. And you can look at the people that live there, and you will find people who are physically active. So, I do think that reducing inequity in physical activity behavior across segments of populations, and learning how to effectively promote physical activity in segments of the population, where there is deprivation and poverty, is a critical need for our field. And I do think that learning how to do that effectively, and then making the case that implementing those actions on a large scale in public health is a moral responsibility that we have. It is an important next step in this work. We've all seen many examples of just how inequitable are the provision of programs and policies that support physical activity, across our communities. And if you if you believe, as I think we should, that a physically active lifestyle is important, certainly to public health, but maybe even more broadly to a high quality of life. If you believe that, and I think we can document that, that's the case, then I think you can argue that we have a collective responsibility for that behavior to be accessible to everybody. And so I'm hoping that maybe an approach that can be effective with policymakers in the future will be the argument that it's just not right that we would have inequitable policies and programs and resources to support physical activity when we know that it's so important to public and personal health.
Mm. And if we jump a little bit back, now you're doing research with very young children or even babies. How do you see the physical activity and public health in case of babies and toddlers and children?
Yeah, I think having worked with physical activity in children for a long time, I believe that the experiences that kids have with physical activity very early in life are very influential in terms of their attraction to physical activity later in life. My group has studied, and other groups have studied for a long time, social cognitive factors that associate with physical activity. We've started studies with kids in the 5th grade, for example. At that stage of development, I think a lot of what they think about physical activity is already established. It's based on experiences that they had, maybe in the backyard as 2-year-olds, based on, how their parents interacted with them, or how their siblings or, kids in the neighborhood interacted with them when they were trying out various forms of physical activity. So, I think only one reason why we need to study physical activity in infants and toddlers is it may well be that the physical activity experiences that they're having at that very early stage in life those factors are going to be influential for the rest of their lives. You wouldn't think it, you wouldn't necessarily see it. You would think, oh, my goodness, they're in the 3rd or 4th grade. We've got plenty of time to help them develop, physical activity skills, and, to learn to enjoy physical activity and so on. And, I think we do. I certainly, I think at any age, people can learn to be physically active and to enjoy it. But from a public health standpoint, this would be a lot easier job if a much larger segment of the population transitioned into adolescence and adulthood already having mastered physical activity as a part of their life. And right now it's just we have a lot of catch-up work to do, a lot of remediation really as people get into adulthood.
Yeah, and you probably have been reading a lot of science throughout the years. What do you see as the most interesting, fascinating research on children's physical activity at the moment? What gets you excited?
Oh, I think social influences are critical, and I just think we need to learn as much as we can about how we can use those social factors in interventions that can be scaled up and applied in a public health setting. It's one thing to do a fairly small study of some intervention, and to show in kids in a single school, or a one particular setting that you can have an effect. But it's something else again to translate that to much broader public health interventions. And so we've got a lot of work to learn how to disseminate and implement physical activity interventions. But I think with children in particular, social factors are just enormously important. And we've learned in study after study that enjoyment of physical activity and something that we call physical activity self-efficacy, which is a child's sense of competence in engaging in physical activity, that those two factors they come up over and over again as important determinants or correlates of physical activity. So kids that enjoy some particular form of activity and who feel competent engaging in that activity are much more likely to engage in that activity regularly than kids who either don't enjoy it or don't feel competent doing it. So, I think the guidance there is for parents and others who work with young children. Put your kids in settings where they're engaged in activities with other kids, and in a manner that they're enjoying the activity and succeeding, feeling competent when they engage in the activity.
And so social factors important, physical activity, self-efficacy. And how do you see that? You've been doing studies with babies and children. What are we lacking from the research methods or measurement methods? What kind of things you have noticed in your projects that we would like to measure this accurately, but we cannot? What kind of things have come up?
Yeah, I think we do need call it more micro research, um, where we study the almost immediate effects on children of modifications to the social environment around physical activity. I think when our field got started doing interventions for physical activity in children and youth, I think we started off trying to hit a home run. We did a bunch of very large scale, multi-center randomized trials, and spent a lot of money doing some quite large scale studies. And I think it was all based on the idea that we knew how to intervene. We just need to try it, in a large scale setting. And, those studies over and over again usually showed significant intervention effects, but small, not very big effects, and so I think one thing our field needs to do is sort of go back to the beginning and try to identify social and other intervention strategies that that we can, with almost absolute certainty, know will have a certain impact on most kids. And then once we've got that battery of strategies that we've demonstrated in kind of very controlled micro environment studies, we have a lot of certainty that they will have a certain effect on kids. Then think about how we can scale that up to application in in schools, in recreation centers, in other settings.
Yeah, I think we are running out of time, so I start to wrap up. Is there anything you want to promote, whether it's a book, whether it's a job position or anything?
No, I want to promote talking to our policymakers about positioning physical activity as a higher priority in public health. I've worked for a long time in the U.S. on our national physical activity plan, and I always tell people, you know, it's your plan. You own it. Take it to your policymaker. Take it to your school board, to your county council, to Congress, and you know, tell them experts say we need to be doing this stuff, and let's do it. So I what I want to encourage is a lot more assertiveness around how we promote physical activity as a critical element in public health.
Hmm. And as a last question to our early career researchers, what would be your advice building a research career? Is there something you would have done differently in your career? What would be the tips for people doing their PhDs or starting after the PhD?
Yeah, I think my encouragement to graduate students and others that are training for a research career is learn as much as you can about research methods and rigor in research, because those pieces apply and are important regardless of the specifics of the study. I mean, if you had asked me when I was training in exercise physiology, in the 1960s and 70s, that I would be doing the kind of research that I'm doing today, I would have had no clue. It just I think in the real world, a research career evolves. One study leads to the next one, and it's very hard to know 5 years in advance what you'll be doing. But I think good research meets certain standards regardless of the setting or the specifics of the investigation that you're doing. So I think my advice would be train in the niche that you're training in today, but learn everything you can learn about how to do research that's rigorous and meets the highest standards. Um, and I think if you do that, those learnings will serve you well the rest of your career, regardless of the direction your career takes.
Mm. Yeah, that's a great point. So thank you for taking the time for this podcast. It was a pleasure.
Thank you, Wally. Great pleasure to be with you. Thank you so much.